with everybody because I'm sure there's plenty of people who would like to get this information who weren't able to attend, because being an educator is busy and sometimes your day doesn't go like you thought it would, and you think you're going to be able to join a seminar at 4:30 and something gets in the way. So we're happy to record this and share with other people, but so grateful to everybody for coming to this MERC seminar that's exploring how COVID-19 has impacted the mental health of our students, for our PK-12 students. We have a lot of information to share today. We'll be able to share perspectives from the research side, but also from the practice side. Our team is working on the final steps of a big systematic literature review. So we're going to be sharing a lot of findings related to that. But we also have a pretty amazing panel that's pulled together here. Misti Mueller from VC School of Education to share about her research related to physical health and mindfulness and mental health for PK-12 students, and Christina Vitek from Henrico County Public Schools to share a division level perspective. And then we have Britney Carr, who's a school counselor in Hanover County Public Schools at their online school. Now I should open by saying I'm formerly a high school counselor, and so this topic is very near and dear to my heart. And so I think this is something that is an urgent need, and I'm excited to have this kind of collective brain power here to discuss this as a group. So I'm going to share my screen. Can everybody see my screen? Karen, give me a thumbs up if you can see it. All right. So welcome everybody. So our focus today is how has COVID-19 impacted the mental health of our students. My name is David Naff. I'm the Associate Director of MERC, and I'm going to let my colleagues and co-presenters introduce themselves, starting with Shenita.
All right, welcome everyone. I am Shenita Williams, and I am a school social worker with Henrico County Public Schools, and also a PhD candidate with VCU School of Education in Educational Leadership Policy and Justice. And I'm glad that you all are here with us.
Good afternoon, everyone. I am Jenna Darby. I am a recent graduate from VCU's PhD in Educational Psychology, and I am also currently the Research and Evaluation Specialist for Chesterfield County Public Schools.
Good afternoon. My name is Misti Mueller. I am in the School of Education, the Department of Teaching and Learning. I coordinate the PK-12 licensure program for health and physical education, and very happy to be with all of you today.
I'm Christina Vitek, Director of Psychological Services, Student Support and Wellness with Henrico County Public Schools.
And I am Britney Carr. I am the secondary school counselor for the Hanover Online School. So I have grades 6 to 12.
Thanks, everyone. I'm really excited about the group that we have here today to talk about mental health in our schools in the time of COVID-19. So why are we talking about mental health? With MERC, we go through a process of selecting our topics where we get input from our school divisions, and we go through sort of like an ongoing vetting process where we discuss these issues that are prominent, enduring and immediate, things that their educators and students are facing. And then we ultimately end up voting on a topic for a study to explore in depth over the course of several years. And our next study, the new study that we just commissioned, is on supporting mental health in schools for students and educators. But in our conversations in selecting this study, I heard it described by one of our school division partners that mental health is the next pandemic, right? So we're living through a pandemic right now, but some of the enduring effects of this are going to have some pretty clear impacts on mental health for our students and our educators. And so this is something that we need to be prepared for. In schools, we've been wrapping our heads around how to support mental health needs during a pandemic, either remotely or in person. Hopefully at some point we're going to be past this thing, and there's going to be some residual effects of COVID-19 and the social isolation that we felt and some of the stressors that have been associated with it. And so we need to be prepared to also support mental health after a pandemic. And to dig into this further, our writing team previously put together a literature review focused on supporting student mental health during and after COVID-19. That's available at this URL here for our website /reports. I'll put a direct link into the chat here in a minute. But when we were putting this together, here's what we were looking at. So we published this in August of 2020. We were looking at research that existed before then, but there wasn't much research that was out there at the time. So we had to pull from research related to natural disasters like Hurricane Katrina and how schools reopened after that, but also things like the psychological effects of quarantine because our students and their families were having to isolate. And so some of the things that we found in this review were that the pandemic has likely impacted the mental health of most students, that there's likely going to be developmental differences in how students process the emotional weight of the pandemic. So younger students are likely to process this differently than older students, for example, that their disproportionate impacts of the pandemic have likely led to disparate mental health impacts, and that student mental health supports will need to be a top priority for all school personnel. All of this is helpful information, but it's all speculative, right? So all of this is talking about like likely impact, likely differences, will likely lead to, will need to be a top priority. Because when we put this together, this was back in the fall of 2020. It's now the fall of 2021. And so we can ask a very different question. We could be much more targeted and actually ask, how has the COVID-19 pandemic impacted the mental health of K-12 students? Because we know that there is empirical literature that's been published on this. And so our team has been working on this very large systematic literature review. And we say emerging literature because there's things being published on this all the time on the mental health impacts of COVID-19 on K-12 students. So let me just give you a quick overview of our methods because I think it's important for you to see what went into this review. So these are the search terms that we used just to give you an idea about like all the things that we were looking at. And the way we went about this, we looked into prominent databases that house educational and psychological research, and excluded duplicates and ended up with over 1,000 studies that could potentially qualify for this literature review. And then our team, so Jenna, Shenita, and another team member of ours named Melissa, screened the articles by title and abstract. And then we eliminated the vast majority of them based on pretty strict exclusion criteria. It had to be related to mental health. It had to be related to COVID-19 in some way. It had to be related to PK-12 students or that age. There's lots of research out there about how college students are processing this, and that's not included in our review. It had to be an empirical study, meaning it had to have research questions and methods and findings of its own, and needed to be written in English. And so after that process, we ended up with 188 studies who could potentially qualify. And then our team went through and dug into the full articles and excluded even more of them based off of these same criteria to make sure that we absolutely had articles that actually met these criteria. And we ended up with 113 studies. And so what you're going to hear from us today is the results of our review of 113 empirical articles in peer-reviewed national and international journals that span from March 2020 to May 2021. This is international research. About a third of it comes from Europe, about a quarter of it comes to the United States, a lot of it comes from China, but we also have other areas of the world represented here. Overwhelmingly, the methods that were used in these studies were surveys, which makes sense, right? Because we were trying to collect rapid information about COVID-19, which typically requires some sort of a survey or questionnaire. That's generally the easiest way to do that. And then in terms of mental health focus, a lot of the studies had multiple focuses for their mental health, but around half the studies focused on anxiety. Depression was also really prominent, but also looking at things like stress, trauma, loneliness, fear of COVID-19, and then other things like externalizing behavior or maybe amplifying things or behavioral issues related to like ADHD, for example. So there's a lot of different focus areas that we're going to talk about today. And based off of these 113 unique empirical articles, there's 5 themes that emerge from the literature that we're going to share with you today. And the first theme I'm going to talk about, which is the disruptive nature of the COVID-19 pandemic for PK-12 students. So it's no surprise, and this showed up in the literature, that the pandemic has been massively disruptive to the lives of our students in many ways. It caused a severe disruption to routine in all facets of life, including school, but not just including school. The research showed that the disruption to routine tended to be more pronounced and impactful for young children, especially pre-K children. Disruption to schooling was also a pretty prominent factor that showed up in the research. And in the studies that asked parents and students what their chief concerns were related to the pandemic and their mental health, over and over again, they talked about how disruptions to schooling was the chief concern that they had. They also discussed stress from online learning challenges that they were having to navigate. And a key disruption that students experienced was social isolation. So having to be away from their friends, but also away from like extended family members and teachers and counselors and people that they really care about, these adults that really help them. And social isolation, which Jenna's going to talk about this a little bit later on, was associated with increased depression. It was also associated with corresponding physical health issues that Misti's going to talk about a little bit later on, including diet and exercise being disrupted. Sleep disruption was really prominent in the research. So it was clear that this had an impact on sleep. And sleep disruption, including going to bed later and waking up later, was associated with increased stress and depression that showed up several times in the research. One study that really dug into this, DiGiorgio and colleagues in 2021, they looked at this where they surveyed 245 Italian mothers of pre-K age children. And they found that parental sleep problems during the pandemic were really associated with child sleep problems. Parents reported increased boredom, difficulty following routines, and self-control issues in their children. And of the different factors that contributed to the negative mental health impacts for their sample, sleep had the highest impact on the psychological well-being of mothers and children in the sample. So sleep disruption is very important in terms of understanding how our students are navigating COVID-19 and the mental health impacts. Additionally, because we're entirely remote, case in point, we are doing the seminar online right now. Research showed that our students are engaging in increased internet, device, and social media use, oftentimes to the point of addiction, according to Dewan and colleagues. But also research showed that high use of the internet, especially if you're getting overwhelmed by information related to COVID-19, overuse of devices, and overuse of stress of social media could be associated with stress, anxiety, and depression. We saw significant relationships there. One study showed an interesting kind of byproduct related to social media use. So Coberge and colleagues, this is a Belgian study where they were looking at adolescents. They found that those with higher anxiety were more likely to report increased social media use. The youth in their study reported that they use social media to maintain peer connection, and social media use actually mediated the negative impacts of anxiety on overall happiness. So social media use, especially for our adolescents, could actually have a potentially therapeutic effect, it seems.
All right, and so for the second thing that we uncovered, it was related to the implications of the impact of COVID-19 on caregiver mental health, which revealed that caregivers of PK-12 students experience an increase in stress and depressive symptoms, due in part to challenges such as lack and/or loss of support and childcare, financial stress, and caring for a child with special needs. So I'm going to talk briefly through a few of these. First, caregivers who experienced a loss of support, such as changes in childcare or a decrease in support from peers and family, they were more likely to experience a worsening in their mental health. Next, many families experience stress related to employment. So financial stress for some led to an increase in food insecurity and low parental response in actually being able to meet the socio-emotional needs of their children. With respect to caregivers of children with special needs, such as intellectual disabilities, they reported higher significant rates of mental health challenges, while parents of children with neurodevelopmental disorders were reporting higher levels of parental stress. And lastly, in comparing pre to post-COVID responses of parent mental health, parents reported experiencing higher levels of stress, depression, and anxiety after the start of the pandemic. We think about caregiver connection with children. There was an increased interaction, we were all seeing it, right, between caregivers and children during lockdown. And this led for many, led to perceived increases in family conflict. And these family conflicts were related to more depressive symptoms and feelings of loneliness. But not all family relationships experienced negative outcomes during lockdown. So that was a positive. In some cases, lockdown actually strengthened relationships between students and their caregivers, due in large in part because they were at home, and that meant there was an increased opportunity for family time and relationship building. So turning our attention to the connection between caregiver and student mental health, what the literature revealed here was that children with a mentally ill caregiver experienced more negative emotions, higher levels of disturbed attachment, and difficulties in emotional regulation. We saw that high stress levels in children whose caregivers had difficulty regulating their emotions. This also was similar to high levels of anxiety in children who had parents with high levels of anxiety themselves. So seeing similarities between levels of stress and anxiety in both of those groups for children and caregivers. In a 2020 study of over 400 Canadian parents, caregivers who reported higher levels of stress, they were more likely to be less responsive to the cognitive and affective needs of children, particularly adolescents. And caregivers with a high school diploma or less, they were less likely to be able to meet the basic needs of their children compared to caregivers with a college degree or higher.
So as David talked about at the beginning, we are not going to really understand the impact of COVID-19 for some time, but the studies that we did look at showed some real-time impact of mental health due to the lockdown conditions. And so the third theme that we're going to look at are those broad mental health impacts, including things like increased anxiety, increased depression, increased feelings of loneliness, and then the fear of COVID-19 and what that implied for our students. COVID-19 has affected the mental health of students in all these ways through a widespread change in mental health. And the studies that we looked at demonstrated those longitudinal studies that had looked at data before the pandemic and then were able to compare, and then those real-time, one-time surveys to parents, caregivers, and emergency departments. The first section that we are going to look at here is the fear of COVID-19. Many studies looked at how if a student already had a mental health challenge, such as PTSD or anxiety or OCD, that they had an increased understanding or mental health challenges. Students often feared contracting COVID-19. They would refer to it as being possibly extremely dangerous or very serious. And of particular concern for students was this idea of the uncertainty and the unfamiliarity of the situation. Interestingly, two studies that we looked at showed that some level of fear about COVID-19 actually changed behavior for the positive because it had a practical benefit, resulting in things like increased hand washing or avoiding public crowds. However, some studies revealed that COVID-19 related fears were connected with economic concerns and could cause greater anxiety or depression in our students. Anxiety, oh, I see. Sorry, I skipped a slide. So for the fear of COVID-19, these two studies, one with Georgia youth in a rural area and one with German youth, show this idea that our students felt this all over the world. Anxiety, as you can see from the examples on this slide, that studies consistently reported higher general anxiety and symptoms in adolescents than in younger children, but all students increased during the pandemic, as the studies showed. Several studies also reported that the prevalence of anxiety was higher in our students than it was for the parents. Anxiety is something to be really looking out for because it was often in these studies correlated with negative attitudes about COVID and was negatively correlated with happiness. Depression is another mental health concern that was raised in a lot of the studies we looked at. The rates of depression were widely reported. The normed cutoff scores for clinical depression symptoms was often used to show that between 14 and 33% in many samples showed that students were above the threshold for depression. However, a few studies even found ratios as high as 64% were experiencing depression of those adolescents. So again, while causality is difficult to ascertain, many of these studies do show that depression was correlated with some really serious, interesting but serious dynamics within families. The privacy issues that resulted from students being at home and having decreased autonomy were all related to those increased depression symptoms. Finally, we have the loneliness of mental health. It comes as no surprise that between 60 and 90% of parents reported that their children often miss their friends. And students also reported that they missed their contact with the caring adults that they had in school, such as their teachers or with their grandparents. One study found that loneliness was inversely associated with happiness, and social isolation was associated with stress and decreased mental health for both children and adolescents. It was especially prevalent for those with previous psychiatric diagnoses. In fact, one study found that loneliness was the most salient predictor for all psychiatric outcomes and was associated in the sample with morbidity and mortality for adolescents.
And so the fourth theme, which I'll have to say, I'm probably more partial to this because it's the social worker in me. And, the information that I'll share in reference to this particular thing really cuts across a variety of student groups. And so I'll talk through those. So starting with, let's look at age. And so what we saw is that PK students, our preschoolers, they were more likely than other groups to miss going to school. They missed their routine and the structure that was provided by early childhood settings. And our elementary students, these students reported higher incidences of feeling nervous, anxious, depressed, and hopeless. And when we look further at this group, about 80% of these students had some level of understanding of COVID-19, because of course they're older than our PK students, but they had a great deal of misinformation about COVID. Our high schoolers, for our older adolescents in high school, not being able to spend time with their friends, decreased their feelings of emotional connection and support. We looked at gender. Themes around gender were fairly consistent across the literature. So on average, female students, they were reporting more symptoms of anxiety, depression, and stress. Male students, they were most concerned with academics, work habits, and their future. And non-binary students, they were reporting most challenges with physical and mental health. We looked at race and ethnicity. So students of color who are already disproportionately impacted by COVID-19, they were also more likely to worry about the pandemic and experience mental health challenges even early on in the pandemic. In a particular study of 2 racially and economically diverse semi-rural high schools, Black and Latinx students were significantly more likely to be worried about the pandemic, getting sick, or having a friend or family member get sick. Hispanic, Latinx, and biracial white and Asian students reported physical health as most challenging for them. They feared exposure to and were worried about contracting COVID-19. The literature did highlight that in spite of high levels of vulnerability with our Hispanic and Latinx adolescents, they demonstrated a great deal of resilience during COVID-19, which may speak to culture as a protective factor in some cases. In a 2020 study, Chi and colleagues explored the mental health impacts of perceived racism towards Chinese Americans during the COVID-19 pandemic. And so what they found was about 46% of youth reported experiencing direct racial discrimination at least one time online, and more than half of them reported experiencing in-person discrimination. When we took a look at the socioeconomic differences, children from low and medium socioeconomic status and students residing in less developed areas may be at greater risk of psychological distress. Students from less wealthy households and no internet access experienced greater levels of stress in comparison to more wealthy families. We found that youth with pre-existing mental health, they may be at greater risk for depression, anxiety, PTSD, and suicide as a result of the fears of COVID-19. Children with neurodevelopmental disorders, particularly autism spectrum disorder and attention deficit hyperactivity disorder, they were at greater risk of mental health challenges and in more need of support than students without neurodevelopmental challenges. Adolescents with a history of trauma, particularly around scarcity and access to resources, they dealt with compounding issues. Higher levels of trauma was also associated with obsessive compulsive disorders and found to be a contributing factor in worsening symptoms in those with OCD. So taking a look at substance abuse, substance use and abuse, a survey of over 1,000 Canadian adolescents found significant increase in substance use. The number of adolescents who use alcohol did not change significantly from pre to post-COVID, but what did change was the frequency at which they were using alcohol. Additionally, there was a significant increase in the frequency of marijuana use during the pandemic as well. And adolescents with higher reported fears of COVID-19 and depressive symptoms were significantly more likely to use substances alone. And lastly, abuse. The stress experienced by parents, such as job loss, depression, and prior maltreatment as a result of COVID-19, led to an increase in the emotional, physical abuse, and verbal aggression of caregivers towards their children. So in essence, our students were enduring more physical punishment and increased conflict with parents after the start of the pandemic.
So the fifth theme that we looked at was this idea that not all of our students had negative impacts. And some of the studies that we looked at actually looked at resilience and coping in response to the COVID-19 pandemic. First, though, not all coping is positive. As we know, disengagement from people and school activities were reported as common negative coping mechanisms. And some other negative coping mechanisms reported included things like video games or increased TV, alcohol, drugs, sleeping, or just avoiding people. Negative coping was associated with higher stress and anxiety and depression. But then some other studies looked at positive coping strategies. According to Zhang and colleagues, coping involves positive appraisal and thinking, distancing, problem solving, and help seeking. And then they go on to talk about how active coping strategies can actually improve mental health by increasing the sense of control that the student feels like they have over their environment around them. And so coping strategies that were explored in these studies included things like humor, staying socially connected through maybe social media, and just in general, the fact that many adolescents are super resilient and were able to use these coping strategies to protect themselves against stress and anxiety and depression. So a few interesting positive mental outcomes from the pandemic, and not that there weren't all the negative things we have talked about, but the studies did highlight a few really exciting positive things that we can at least acknowledge also happened alongside the negative. Students often reported that they especially appreciated time at home with their parents and autonomy in some of the activities that were available to them through those changes. Students who had previously maybe been under super high academic pressure often felt that at home they had much less pressure or had a decrease in the social pressures that they had previously felt at school. Jones and colleagues actually looked at the removal of peer stressors as one of the causes for decreased social anxiety and the pressure to conform to society's expectations, especially around gender. For our gender diverse students. And those students actually were able to report a positive mental health change. So we're able to take from some of those studies some strategies to help promote student mental health during the pandemic. So obviously these studies are all from during the pandemic, but we're able to learn a lot from that. So many of these studies reviewed examined current practices. It's worth noting, again, that these are not experimental or intervention studies, but we're still able to learn a lot from that. One strategy suggested through these is physical exercise and how that can be a protective factor against depression, anxiety, and psychiatric diseases. Technology can also be used to learn about COVID-19, the prevention of COVID-19, the trends and how it's spreading, and those are actually found to be protective factors for our students. Several studies also found that having a daily routine could be a positive effect for students, or students feeling more committed to school could be a protective factor. Spending time on creative practices was found to have a really positive effect. Things like students who talked about art or listening to music or reading or playing freely all reported more positive mental health effects. And then finally, a common strategy for addressing mental health concerns analyzed in our research was the support that is offered through friends and family. The support, it was such an important factor shown in a lot of the studies. And that social support doesn't have to be in person. It could be found online or with parent groups or other virtual contact.
So taking all this information together, what are some of our recommendations that boiled out from the literature? So recommendations for supporting mental health in schools. One, it's really important to recognize that the vast majority of mental health support occurs in schools. With Shenita's dissertation, she has this great literature review that talks about the importance of this. And we've incorporated some of that into our report, but some research shows that students or school-age youth are 21 times more likely to receive mental health support in school than they are from a community organization. So it's really important to recognize that this is where the majority of mental health support is happening for PK-12 age youth. It's going to be necessary for us to train our educators in brief mental health interventions like solution-focused brief therapy, rational emotive behavior therapy, for example, because school counselors and social workers are going to be overwhelmed by this because there's just going to be so much need and we don't have enough counselors. And so it's really important that we recognize that teachers are going to be tasked with also addressing the mental health needs of their students. This is not to be any sort of substitution for speaking with a school counselor or social worker or psychologist, but we just need to keep in mind that the need is going to be high, and so it's going to be important for our teachers to be trained in this. We need to pay attention to the mental health of parents and caregivers when supporting students because there's a very clear connection. So understanding what students' families are going through is going to be important for understanding what our students are going through. Schools and school divisions should consider additional screening for mental health challenges with their students, with one caveat that ethically, if you find out that there's widespread depression, anxiety, and stress in your student body, but don't have the resources to be able to actually meet it, then it could potentially pose a problem. In our conversations with school divisions thus far, there's been sort of this coalescing around an idea of like, we should assume that there are increased needs and just go ahead and plan on rising to that challenge. It's important to help youth maintain their social networks as much as possible, even during remote learning. So understanding their need to engage in social media and finding other ways to help them connect. And mental health supports in schools need to be prioritized in policy and sufficiently resourced, including making sure that our school-based mental health professionals are able to spend their time doing mental health supports for their students rather than some of the supplemental things that they end up getting tasked with doing, but also hiring additional school-based mental health supports. And if you're interested in any of these recommendations, I have an itemized list I'd be happy to send your way. So feel free to email me and I can provide additional information related to this. And so when we talk about mental health as the next pandemic, this is really what we're talking about, these themes that emerge from the research. And this is why it's really clear that prioritizing mental health in schools post-pandemic is going to be really crucial. And to help unpack this a little bit more, we've brought together some experts from the field to talk about what this looks like from a variety of perspectives. And we're excited to have Misti start that conversation.
All right, I think we all need to just take a deep breath after all of the information. That's a lot to take in, and just such an extensive evaluation of everything that's happening. I'm very happy to be here with you and to share a little bit about physical activity, movement, mindfulness in schools. David, you can go ahead. We can go to the next one. So I just want you to take a second and read this, please. I like to start presentations to, especially with educators and pre-service educators, to let them know that, originally we used to think that, okay, we're going to address the mind over here and then we'll address the body over here. We'll keep them separate. But what we have known for a very, very long time, that the mind and the body are so intricately related, and it's important to address both and to not keep them in isolation. I don't know if you've seen these images before, but just one, if I had to choose an image to really make the case for why exercise is important, especially for our students when they're in school, if you look at the image on the left-hand side, you can see that this is a scan of the brain after sitting for a long period of time. And the image on the right is what the brain would look like after going for a 20-minute walk. So we know if our students are sitting for a long time, if they are not at their best, if their mental health, which we know is suffering right now, we know that exercise can not only help improve their academic success, but it also releases those hormones, the neurotransmitters that help us to feel better. And so even short amounts of activity and movement will improve mood and overall just general well-being. And this just is another image that I thought just kind of helped. So many of us, I think, can relate to the side on the left, or we think of our students and they've got all of these things that they're wrestling with and everything that was just shared with us in the slides prior to this. And we know time after time it's been proven that if we move our bodies for a short amount of time, it helps to deter and start helping us feel better, thinking more clearly, and just in general enhances our well-being. So this is exercise and sports science from Australia. They give a good example of all the many benefits of exercise and how it will improve mental health. Just starting at the top right, so it boosts the happy chemicals, not necessarily with students depending on the ages that we're working with. We don't need to go into all of the science, but we know and can share with our students that when we move our bodies, our brains are stronger and our emotions are better, so that we are able to navigate during our school day. It helps improve self-confidence, enjoying the outdoors, preventing cognitive decline, alleviate anxiety. So each of these things over here that are specifically related to mental health, we know that when we move our bodies that we can help. It doesn't make the stressor or the things that are causing the anxiety go away, but for that moment at that time, we can start recognizing what it feels like, physically feels like, to feel better after we move. I wanted to share this with you. So my students in my classes, we read a book by John Rady, and I have an image of that on the next slide. But what I have the students do is they go through and they have to visually represent what the message and the information, the chapter specifically tells them, or their takeaway. And the specific 3 chapters in this book are specific to exercise and how it impacts stress, anxiety, and depression. And so from this, you can see at the top left, so before a walk, the student is very anxious. They feel like they can't breathe. During the walk, they're feeling a little bit calmer. And then post-walk, I feel happy. Over here at the bottom left in the middle, it's kind of what the author suggests is it's like freeing the brain so that just that general feeling trapped, the anxiety that just keeps us from performing well and feeling better, what exercise tends to do. Over on the left, there's a lot of research about physical activity and how it improves mental health, well-being, and to the point where sometimes it can alleviate the need for medication, for anti-anxiety medication, if not completely alleviating the need, maybe perhaps a lower dose. And oftentimes we're so quick to run to the doctor and say, I need medicine because I'm depressed, or my child is depressed, I think they need medication. And I just wish so desperately that the pediatrician or the doctors would say, are they moving? Are they exercising? Are they practicing mindfulness? Connecting with the foods that they eat? And I am all about using medication to support mental health, but I think there's so much that has been untapped as far as ways we can support our students in the day to increase their opportunities to move and just help them start to experience what it feels like and how they feel after they've had an opportunity to move their body. And this is just, I just wanted to give you, let you know what the book is. So it's a great read. It's an easy read. If you have any interest, all of my college students, after they read this book, they said they're going to buy it for everybody that they know because they had no idea that exercise can help them with so many things. So I wanted to touch just a little bit in the time that I have with you on the benefits of mindfulness. A lot of teachers will talk about wanting to use mindfulness in their classroom, but maybe don't really know how, or have a different understanding of what mindfulness might mean. They might feel like that would mean they have to teach their children how to meditate, and there's so much more to mindfulness than that. So rather than just saying they've got to exercise. We need to help our students and us as the educators finding the time to just pause for a minute, learning how to breathe, learning how to be present in the moment so that they are in a position when they're with us that they feel safe, that they know that, okay, during this time, I know how to use my breathing technique if I'm feeling really anxious before a test, or I come to school and I've got all of these things that I'm bringing with me. Sometimes I don't even know how to express them. But when we're able to process and participate in mindful activities, each of the bubbles that you see at the top, it helps regulate their emotions, it fights depression, anxiety, the key things that right now we're really looking at that we need to support our students. A couple different slides on some statistics, and this is prior to the pandemic. I felt like it was important to just recognize that even before COVID, we have a lot of things that our students are facing with anxiety, trauma, distraction, and isolation. And I know loneliness was one of the things that was mentioned. So if you look at the statistics that were shared today versus where they are, we just know that these numbers are increasing. And the same with our teachers. We talk a lot about supporting student mental health, but we definitely have to work to support the teachers' mental health as well and help encourage them to take advantage of some of these practices. Thank you.
All right, so I'll go ahead and pick up and speak to how school divisions are supporting the mental health needs of our students kind of at large overall. In Henrico County, we've been really fortunate that we'd already started our journey trying to expand our trauma-informed practices and our mental health service delivery pre-pandemic. So we had already been doing a lot of this work in our schools. However, as we thought about what our next steps were, as we welcomed our students back this fall, we felt that we really needed to start with the basic statistics and sharing with all of our educators, our building leaders, our central office staff, that this impacted everybody, just as the research that we just heard showed. We're no longer talking about students that have experienced trauma as an isolated group. We needed to change our entire frame of reference to understand that this impacted all of our students. So we really started at the top with education and sharing information such as what is here to give them that visual that, you know, a lot of students lost a primary or secondary caregiver, and millions of family members have grieved the loss of a loved one. That hits home for a lot of people, helps it put it in perspective. And then beyond that, this list kind of gives the rundown of all of those things that are contributing to the mental health needs of our students. So we recognize that each student has had a unique response and reaction to the COVID-19 pandemic. And for some, they've been impacted by all of the things on this list. For others, maybe one or two. But we wanted everyone to be very well aware that we were going to be hard pressed to find a single student who wasn't impacted in some way. So we really wanted to gear up our leaders and our teachers to be ready to act and approach this from that tier 1 level. This is what we're doing for all. The mental health supports that we need are for all of our students, not just some. We have a great partnership with our community agency and had some data from them to, again, help put this in perspective, just to recognize that we saw a peak in youth admitted to Henrico Mental Health as of April 2021. That was April 2021. We were planning to come back to school in September. We knew we were going to have more significant need presenting, and we needed all hands on deck, and we needed this to be a priority. One of the greatest tools that we found helpful was utilizing the U.S. Department of Education's roadmap, Return to School roadmap. If you click again, I think the indicators will maybe come up. Perfect. So what this document did was it really helped lay the framework by creating these landmarks to, again, get this understanding and buy-in as to why supporting students' mental health was so important. We work for a public school system. Our ultimate goal is to provide education, but this outlined the need, first things first, landmark one, we had to prioritize the health and safety of all of our students, school personnel. We did a lot of that with all of our mitigation measures, our vaccination clinics, everything we put in place to keep them safe allowed us to return. But landmark 2 was where we were. We needed to build school communities and support students' social, emotional, and mental health needs. It's not until landmark 1 and landmark 2 are achieved that we can truly embark on landmark 3, which is accelerating academic achievement. And this was a really, really important point for us to put out to our leaders and our teachers, because this is the evidence, the need and the priority, the Maslow before Bloom. We have to provide the social, emotional, and mental health needs before we can really make up for all of that missed instruction and the gaps in instruction. This quote was one that we had all of our educators read, really take to heart. I have them at one point all read with me the blue words here, again, to instill this. And I think that this has been the hardest part for us, honestly. And I know Shenita can chime in on this, but we felt the pressure as a large school division to remediate the lost instructional time and to get our students back where they need to be academically. But we also knew that we needed to meet the social and emotional needs before we could do that. Those are two, they're not really competing forces, but they are competing priorities. And so we really had to show our educators, show our teachers, provide our staff with tools in order to do this, because we knew it was a big ask. So some of the things that we shared with our staff across the county were, again, tier 1 supports. So we have implemented social emotional learning curriculums in all of our schools from grades pre-K through grade 12. We've incorporated these activities. Direct lessons are delivered weekly, but then we also have built-in morning meeting time and opportunities for community building with the teachers and peers. We heard loud and clear from some focus groups that we had run that teachers and students needed this time to reconnect. A lot of our students lacked that social interaction, as we heard, so they needed that opportunity. However, we also heard that they needed to learn how to be students again. Many of our students stayed virtual for the entire year. So we've leaned on our positive behavior intervention supports, PBIS structures, to reteach behavioral expectations to our students, to remind them what it's like to be in the classroom, how to walk in the hallway, as well as incorporating new lessons about mask wearing and hand washing and things of that nature. So we've really approached our support, again, from that tier 1 level. This is what we're doing for all. But then we've also layered in some additional evidence-based strategies that our school-based mental health staff have access to. We've added a new intervention, Check and Connect. We do the signs of suicide, prevention programming for targeted groups of students. We've invested in the CAT project and Coping CAT to address the heightened anxiety that we've seen. And we've also increased our number of school-based mental health providers so that we're able to reach more students more often. We've leaned heavily on the leadership of our school counselors, school psychologists, and school social workers. We do have a lot of them in Henrico County. We always need more, but we are thankful to have who we have. So we've really prioritized emphasis on the skills that they're trained to utilize to provide those mental health supports. Oftentimes we'll get lost in the chaos of the everyday, just work that needs to be done related to scheduling or special education evaluations. So we have really publicized and reminded all of our staff and the importance of prioritizing their schedules so that they are not on unnecessary duties, but they have time to really work with kids and time to be in the classrooms. We've reminded that all of our school-based mental health staff have training to provide all of these services. So we've been sharing this with our building leaders, with our teachers. We've been offering additional professional learning opportunities to kind of hone up these skills in our staff to increase their confidence, and really push that implementation. We have you in the buildings. Let's make time so that they can do the work that they really love and want to do, because we know our kids need it. Well, we've implemented all of these tier 1 and lots of tier 2 and even some tier 3, like really intensive interventions to support the mental health needs of our students. We also recognize that we can't do it all, and we rely heavily on our community-based mental health partnerships. So we've spent a lot of time grooming these relationships, getting additional information, bringing our community partners in to present, to speak to principals, to speak to teachers. We've expanded partnerships with additional agencies. And then we, of course, are so fortunate we have Henrico County school liaisons that help us. So we have seamless referral and intake processes with Henrico County Mental Health. And just having names, numbers, and people that are able to make these connections allows us to then provide that additional support that's beyond what the school can provide to students that really present with that intensive need.
Awesome. Thank you for sharing all of that. That is very helpful for me, as well, as I am still what I consider brand new in my position, being virtual with students. I just started back in July, so I'm still learning a whole lot. So thank you so much, Christina, for that. But how can counselors meet the mental health needs of students? So just to give you guys background, Hanover Online School was established last year, where we offered all of our students an option to go either face-to-face or online, fully 5 days a week, all day. And we decided to keep the online school this year. So this year it is much smaller. Last year was about 6,000 students. This year, I serve between grades 6 to 12, 330 students. So it's definitely a little bit more manageable. But my background is middle school, so I'm still very new to the high school setting. Most of our students are doing okay online. These are students who in face-to-face settings were what they report socially awkward or felt better about being virtual. So they are comfortable being virtual. But we also have other students who don't have a choice. Either they're living with a family member who's, immune compromised, or for whatever reason, they have to stay online. So we have had some students report high feelings of stress, high anxiety. Particularly this year, it is a expectation that all students actually keep their cameras turned on during class. And I'm seeing lots of self-confidence and anxiety issues, particularly with girls, because they hate seeing themselves on camera, to the point where I've had some tell me that they don't look in mirrors anymore. They don't like for people to watch them eat. And we've had some who've had to be now on homebound because they just cannot cope with being on camera. So we're definitely seeing those things online. So a couple of things that have worked for me so far, and again, I am still learning. And let's see, I have some notes over here, but the first one, to be intentional about making connections, which is a little tough to do online, especially for students who won't respond to your messages in Schoology, or for parents who will not respond to emails or answer their phones, or their mailbox is full, those kinds of things. I do have to work extra hard to try to get out there to make those connections. So I try to make positive phone calls, positive emails. I do post weekly on Schoology, where I'm posting pretty much what my schedule is for the week. I also post like a mindfulness tip. If there's some sort of awareness, like we just had Native American awareness or heritage awareness, I make posts about those, and then offer some tools and strategies to help with kind of the common things I'm seeing, which is anxiety, stress management, stuff like that. On Fridays, I actually put it on my calendar. If it's not on my calendar, it's not going to happen. So I have to put it on my calendar that I'll spend all day on Fridays popping into classrooms. So I go back and forth between middle and high school, and I just pop in. I learn a lot. I go back to algebra and geometry classes all the time because math is not my thing. So I feel like now I can learn some new things. And then that's a good way to really get to collaborate with teachers as well. And they get to see me and feel comfortable coming to me with their concerns if they have an issue with a student. We, in Hanover, all of our counselors under the direction of my director, Carla Allen, we all are part of what we call the Go Green project, where we literally create like a spreadsheet of all the students that we serve, all their names. And then as the school year progresses, those students, they start off as being red because we are getting to know them or we don't know them. And then the goal is to, by either the end of the year, or if you travel with students, so you get them in 6th grade and then you leave them when they're in 8th grade, by the time they get to the end of the time you're with them, all your students are green. So she has really been promoting that, and we've all been doing it. And that is a really good way for accountability purposes as well, to make sure you're building those connections with your students. Be proactive and preventative. So a lot of what I do is like tier 1 level stuff, because I just want to make sure I'm not missing the students that will not come up in like our red flags sort of type of meetings, or students that will not reach out to me. So I try to be as proactive as possible by doing classroom guidance lessons. I was actually in classrooms yesterday and today, and my lesson these past 2 days introduced the 4 small groups that I'm running this semester. So that way every student knows that they have small groups available to them, and they know which ones, which opportunities they have this semester. So small groups, classroom guidance lessons. We have SEL lessons as well. We use Connect with Kids in Hanover, and our students have SEL twice a month during office hours. So everybody has to be there. It's during 3rd block, where our 3rd block teachers actually work with those students and do a lesson that way with SEL. And what else? I guess this kind of, I'm going into the needs assessment stuff now, but I was very proactive with my groups and small lessons because of the data that we saw last year with students being online. And also just, you know, we know the data now that the pandemic has happened. The mental health for kids has skyrocketed. We know anxiety has to be addressed. We know stress, we know grief and loss. So those were also things I used to really conduct my lessons in my small groups. And then needs assessments, I always start the year with a needs assessment. And this year I was very specific about asking the students what they felt they needed from me. And I actually asked the American School Counseling Association. They have their mindsets and behaviors that we follow. And I used those as questions in my assessment. So a lot of my students reported that they needed support with the development of their whole selves, including a healthy balance of mental, social, emotional, and physical well-being. So that has been pretty much my target of every interaction that I've had with students so far this year. Hanover also did a universal screener back at the end of September, where students self-reported any feelings of not feeling safe, feeling sad, angry, or whatever emotion, and then they indicated whether or not they needed to talk to a counselor. So students that did report feeling unsafe and that they needed to speak to a counselor, I individually reached out to those students. But again, that's still relying on them self-reporting and being honest about what they're feeling. So that was another good strategy to use to reach kids. And we also do signs of suicide. I know Christina mentioned that, and it's horrible. The last time I was the 7th grade school counselor at my old school, we actually did signs of suicide for the very first time that school year. And you guys will not believe it. We did it the week that we were sent home for the pandemic. So that was quite an adventure. Our last day of school, we literally did signs of suicide that year, where I actually had lots of kids that had to see counselors, with a few that required a crisis phone call to our CSB. So unfortunately, that's how we ended our year, but that program was so helpful because we caught a lot of kids that I would have never guessed had any sort of mental health or suicide ideation. So that's a very good program as well. I haven't done it yet online. I will do it, but I just need to figure out the logistics of it. of making sure that I have like extra counselors on hand, making sure our safety officer is aware in case anyone needs a home visit, making sure CSB is aware. So I just have to work those out. But yeah, the needs assessments are definitely super helpful in the online environment. And then number 4, meet with teachers and administration often. So use your resources. Teachers are in there all day long, you know, with students, and they're seeing everything. They're hearing the backgrounds of students. If they can hear things going on, they can see when students are like learning from a car or learning from somewhere outside, like just kind of those small things that I just don't really tend to think about. I've had to really pay close attention to this year, and I would not be able to do it without the help of teachers. So I actually we meet every week, myself, my assistant principal, a SPED senior teacher, and all of our middle school teachers, and then separately with our high school teachers. We meet once a week to go over any concerns of attendance, of grades, and in a face-to-face setting, we would include discipline. But so far this year, we have not had discipline, but we certainly have had changes in behavior. So if teachers are starting to notice that certain students no longer turn their camera on or are constantly late or not showing up to class, those are the behaviors that we're watching for, definitely any changes like that. And then after those meetings, that's another indicator for me to reach out individually to those students, so that way we can schedule a Zoom chat with each other. And then be present. So I actually already talked about this with, you know, going into those classrooms every Friday, doing those weekly posts on Schoology. The school sends out a weekly newsletter, and there's a counseling corner section on there. So I try to throw in information where I can to make sure that all of our families know that they have me as a resource. When I do get in touch with families, I try to give them resources. So CREST is a big one that I use, CSB, and then unfortunately I have had to send folks to the ER. I've had to call 911, you know, for serious student situations, but just giving families those resources can certainly be helpful for the mental health of their students. So again, my kind of suggestion and feedback is just to do as much as you can tier 1, to try to capture all the middle of the road students, to capture all the, you know, tier 3 kiddos, and then hopefully that filters out where you can just meet individually with students. Hopefully they start to feel comfortable. The more they see you, the more that they know who you are, then hopefully they start to reach out to you virtually. But it just takes a lot of legwork in the front end.
Thank you so much, Britney. And I know that we are over our time because we had so much information to share tonight. So I appreciate everybody for sticking with us. This is our contact information. I highly encourage you to reach out to us if you have any questions or if you just want to make any kind of professional connections around supporting student mental health in schools during and after COVID-19. We're eager to be partners in this effort for sure. I know that there were some questions in the Zoom chat that we weren't able to get to, so I would encourage you to reach out to folks through the contact information that you see here. I'll also send an email tomorrow to everybody who RSVP'd for this event with a link to the video, as well as some evaluation materials and our copy of our slide deck. But we're grateful for you being here and for all the work that you're doing, and we wish you and your students wellness. So take care. Thanks, everyone.